Hi everyone, it's Lisa with livingwithasthma.net, and we're back with another of our Asthma House Calls where we get to sit down and talk to some of the very best doctors who are treating asthma in children. Today we get to sit down again with Dr. Robert Reinhardt to talk about some exciting new research on asthma that was just released. Dr. Reinhardt is the U.S. Medical Director, ImmunoDiagnostics, Thermo Fisher Scientific. He's also the Associate Professor of Family Medicine at Michigan State University College of Human Medicine. Thanks for being with us, Dr. Reinhardt.
Hi, Lisa. It's nice to be with you again.
Now, just to start, tell us about the study which just came out in the Journal of Asthma. What was the study looking at?
Well, this study, which was supported by Thermo Fisher Scientific, was looking at the control of asthma patients, actually more than 1,600 patients in Southern California. These were children who were cared for by the Breathmobile program, which is well established. It started in Southern California and has spread to some other areas of the country. And they literally go around in a mobile asthma clinic and evaluate and care for children with asthma. So they looked at the allergic aspect of these patients' asthma. It's been well known that many patients in the pediatric population who have asthma have what we call allergic triggers, and in some studies the numbers are up to 90% of asthmatic children who can be demonstrated by testing to have one or more allergic triggers. So in this group of Hispanic asthmatic children in Southern California, they looked at the testing results from allergy testing and then looked out 6 months to see how the children did compared to the kinds of sensitizations or allergy testing results that they had demonstrated. And the results were pretty impressive. In this population, around 70% of the children had allergic triggers, and they were of the kind that are commonly seen. Most asthmatic patients who are allergic have sensitizations to some of the common things that are mostly found indoors, such as house dust mites and pet danders and some of the molds. But the two very interesting findings in this study were that the patients who had pollen allergies, which have been thought to be somewhat less important in asthma, and who were intermittent or apparently less severely asthmatic, that combination of intermittent asthma and sensitization to pollens seemed to predict that these patients would be out of control with regard to their asthma symptoms. And so these outdoor pollens, these outdoor triggers, which are thought to be not so important, may very well be. And these intermittently symptomatic patients who were thought to be sort of a less severe group who we didn't need to worry as much about, they may be a group that we need to pay more attention to and that we need to do more testing for.